In this presentation, I'll be walking you through the mechanism of activation of lovastatin and cholesterol biosynthesis. I'm going to connect the biochemistry to the clinical impact, so not just what happens in the pathway, but why it actually matters for patient outcomes. First, let's begin with the big picture. Cholesterol is often viewed as something negative, but it's actually essential for normal physiology. It plays a critical role in maintaining cell membrane structure and fluidity, serving as a precursor for steroid hormones like estrogen and testosterone, and forming bile acids, which are necessary for fat digestion. So, cholesterol itself is not the problem. The issue arises when there are elevated levels of LDL cholesterol, what we often call bad cholesterol. High LDL leads to cholesterol buildup in the artery walls, forming plaques. And over time, this process is called atherosclerosis, which can restrict blood flow and significantly increase your risk of heart attack and stroke. So, from a clinical standpoint, reducing LDL cholesterol is one of the most important strategies for preventing cardiovascular disease. Now, let's look at how cholesterol is made in our body. Cholesterol biosynthesis occurs primarily in our liver and begins with acetyl-CoA. Through a series of enzymatic reactions, acetyl-CoA is converted into intermediates, eventually forming cholesterol. There are many steps in this pathway, but you don't need to memorize them all. Instead, what's most important is identifying the key regulatory step, the step that controls the overall rate of cholesterol production. Because if you can control that one step, you can control actually the entire pathway. So that brings us to that one step, the rate limiting step. This is the most important step in cholesterol biosynthesis. The rate limiting step is the conversion of HMG-CoA into malevolate. This reaction is catalyzed by the enzyme HMG-CoA reductase and requires NADPH as a reducing agent. Because this is the slowest and most regulated step in the pathway, it essentially determines how much cholesterol is produced overall. So, biologically, this enzyme acts as a control point, and pharmacologically, this makes it the perfect target for intervention. And that brings us to, what is lovastatin? Lovastatin is a medication in the statin class, which is widely used to lower cholesterol levels. It was originally derived from a fungi and is specifically designed to reduce that LDL cholesterol, or that bad cholesterol. Statins are among the most commonly prescribed drugs because of their strong evidence in reducing cardiovascular events, like heart attack or stroke. But what makes lovastatin especially effective is how specifically it targets that rate-limiting step we just discussed. An important detail about lovastatin is that it is a prodrug. This means that when it's first administered, it is inactive. It exists in a closed ring structure called a lactone form. Once it reaches the liver, enzymes then convert it into its active form, a beta hydroxy acid. This active form is structurally similar to HMG-CoA, which allows it to interact directly with the enzyme HMG-CoA reductase. So, activation in the liver is a crucial step before the drug can actually exert its effects. So now we're going to get into the core mechanism. Lovastatin acts as a competitive inhibitor of HMG-CoA reductase. Because its active form closely resembles the natural substrate HMG-CoA, it competes for the same binding site of the enzyme. When lovastatin binds to the enzyme, it prevents HMG-CoA from binding. As a result, the enzyme cannot catalyze the conversion of malevolate. This effectively reduces the production of cholesterol at its source. So instead of affecting multiple steps in the pathway, lovastatin targets the most critical control point with high specificity. So you may be wondering, what actually happens in the body when cholesterol synthesis decreases? Well, first, liver senses that the cholesterol levels are lower. In response to that, it increases the expression of LDL receptors on its surface. These receptors bind circulating LDL particles and then remove them from our bloodstream. So you get two major effects. One, decreased cholesterol production, and two, increased clearance of LDL from our circulation. This dual mechanism is what makes statins so effective at lowering blood cholesterol levels. These biochemical effects translate directly into clinical outcomes. So, by lowering LDL cholesterol, lovastatin helps reduce the risk of atherosclerosis progression, so that buildup of plaque in our arteries, which can ultimately lead to heart attacks and strokes. And this is why statins are considered first-line therapy for patients with high cholesterol or increased cardiovascular risk. Now, to kind of summarize it all, cholesterol synthesis depends, again, on the enzyme HMG-CoA reductase. Lovastatin, the drug we talked about, inhibits this enzyme through competitive inhibition, but only after being activated in the liver. So this leads to decreased cholesterol production and increased LDL clearance. And ultimately, this results in improved cardiovascular health. So even though the pathway is complex, the therapeutic strategy is very targeted and highly effective.